For many, knee pain turns everyday steps like climbing stairs into a struggle. The simple joy of movement fades as cartilage in the joint wears thin, leaving bones rubbing together. In the past, doctors treated severe joint damage by removing the worn surfaces and installing large metal and plastic parts. These artificial implants return some function, but the surgery is major, the metal parts only last so long, and revision surgeries can be difficult, especially later in life. Today, scientists are investigating a new direction, helping the body regrow its own cartilage and bone. Instead of replacing the whole joint, they use bioactive gels and 3D printed scaffolds placed only where damage exists. Researchers can make these scaffolds with special gradients softer on top for smooth cartilage, stiffer below for tough bone mimicking the real knee. Early animal studies and first clinical trials show smoother cartilage surfaces, better healing, and less inflammation than many older methods. Still, these approaches are mainly for younger patients or those with small, localized injuries, not for joints with severe arthritis.
Will I be able to avoid a metal implant?
For some in the future, doctors may be able to patch and regrow just the damaged area, preserving natural movement and making future repairs easier. The work continues in clean labs and clinic rooms where researchers, doctors, and patients all look forward with hope.